Our next presentation is by Mr. Philippe Lottin, who's Deputy Managing Director of Digital Strategy Implementation, Information Technology Branch, Ministry of Health and Social Services from the Government of Quebec. Mr. Lottin is going to talk about digital transformation and the QC Health Plan.
Member of the Board of Directors at Canada Health InfoWay, so we saw a little sneak preview. So there's lots of great things going on in Quebec. So, Philippe, merci.
Philippe, the floor is yours. Good afternoon, everyone.
Both presentation in French and in English, so you can concentrate of understanding what I am trying to explain. You will have documents to further take notes. I am going to do the presentation in French, and as we benefit of our presence in Montreal, so if you want to grab a headphone, it's the time, and I will try to speak not too fast for the people able and in charge to translate what I'm going to say. So, bonjour tout le monde, comme vous l'avez.
Good afternoon, everyone. My presentation is going to be in French once again. And just before we get started, am I the one moving my slides? I am. Autonomy, that's what we aim for. Connected health and digital health. So we practice that for ourselves as patients or for our citizens, which requires from us to know how to use technology. My agenda, first of all, the digital transformation and Quebec Health Plan, the technological modernization plan, it's a 5-year or 3-year plan, and the DSN, digital health record. First of all, the digital transformation and Quebec Health Plan. The Quebec government's health plan was tabled, and right away the Minister of Health established legislation where digital health has to be part of our health plan. And this will cover various dimensions of our healthcare system. It's patient-centered, as you can see on the graphic. Even if it isn't fully translated, you see the clients that this includes. In Quebec, there is only one department. Even if we have 3 ministers, they are all under the umbrella of a single department that's in charge of the 3 areas of our healthcare system. The health plan, in my view, depends on technological modernization. First of all, our minister asked us to work efficiently. We want to adopt the proper tools to work efficiently, and this must lead to better healthcare for the population of Quebec. We also have outdated systems, and the health plan includes 50 measures, 19 of which are based on technology. Now a few words on the technological modernization plan. The first element of this plan, as I said earlier, includes 1,600 facilities in Quebec for a total of 8 million population. We have 9,000 IT systems. As high as that may sound, it's a big challenge for interoperability. We have 9,000 systems within the same institution, in some cases up to 8 or 9. And with all the question of connection and biomedical technologies, the storage capacity that's required, we built our system that way for several years, for the past 25 years. And our healthcare system can be represented by this graphic. The M3S in Quebec, these are integrated healthcare centers that may be related to an academic institution or not. Some of them have a teaching and research mission, others don't. Then we have the first private sector line and the emergency hospital services. And on the right-hand side, you have private institutions that contribute to our public healthcare system. Some of them are within the institutions and others are in private clinics. We also have community organizations that play a crucial role within the system for users and patients for various programs, cancer, mental health, etc. And we also have other resources or non-institutional resources that are available to different clients, physicians that may visit patients in other areas. We also work with other partners. We all reacted to the pandemic fairly quickly, as all the other jurisdictions did as well. It was a difficult challenge, but it does have its success stories for booking, for various tracing, screening activities, immunization, with various platforms that were implemented in record time. We also worked hard on tracing because at first we traced all contact cases with digital tools. You may have followed the whole vaccine passport implementation where we had a QR code on our smartphones. And after that, we had a platform to book appointments for immunization. This demonstrated that we can implement added value and services fairly quickly. And the minister said, well, you managed to do this. Can you now implement all the rest, patient records and questions of interoperability between the different stakeholders? This falls in within a more general program from the Treasury Board and government or the Quebec Digital Shift. The first important element is that it has to be focused on the population. It is a population-based initiative so that they may interact with public organizations, and these organizations have to be more proactive and not wait for the population to come visit the system. And we want to avoid duplication when it comes to contacting the healthcare system. These are shared objectives, and on the other hand, we have to work on administration in the healthcare system. Employees are the ones who are at the heart of this shift, and we can't forget the crucial role they play within that shift. People want to have a big celebration to throw faxes down the river, so we share that idea. And for the continuity of care, faxes don't make sense. And some ministers want us to get rid of them with reason. It's not for the sake of digital technologies, but we do share something in common. We want to optimize data, and our minister asked us to use all of this data within this shift to improve the healthcare services for the population of Quebec.
Des objectifs qu'on partage.
These are objectives that we all share. So the technological modernization plan, well, what exactly will this bring about? So I'm going to present you a synthesis, and I don't want this to be too long, but I'm going to present a number of slides. First of all, and I think I've messed it all up. I'm going backwards. Here we are. So the Technological Modernization Plan consists in 4 components. First, we have to deal with infrastructure. We have to modernize our technological infrastructure. That's telecommunication. It's about cybersecurity. As you know, in Quebec, we have legislation and a ministry that were put in place to cover cybersecurity. It sets very specific guidelines and standards that we have to comply with. We are also going to be working on the cloud. The Quebec government's ambition is to even have a government cloud infrastructure within a certain amount of time. Again, we want to deliver services from the cloud. So that is our approach. And here I detail it a bit. I'm not going to revisit it later. The second point is what we call the technological architecture. And this includes the digital health record that I'll come back to, as well. It includes the modernization of all of the HR and other administrative systems to bring them together under one program. If you follow the news, we had a first bid. There will be a second one, and that's underway. All of this is at the behest of the minister. It's to put together a dashboard that allows us to follow through on the results for managers, citizens, patients. And the third axis is have a completely centralized approach that may be kind of paralysis. A ministry is never as agile as we would like it to be. But the idea is to focus on a decentralized, rather, modernization plan to provide institutions with guides. And again, I'll come back to this, but again, to have the necessary measures in place and to allow for innovation in institutions that make it possible for us to move forward. And finally, it's very nice to have a plan, but we will have to carry it out, we'll have to manage it and pay for it, because all of this costs a little bit of money. So in terms of our means and our ambitions, as I'll come back to in a moment, the Ministry of Health has negotiated some funds with the other ministries in the upcoming 3-year budget. This is there, but we do need the human resources and the talent in place for now, but also we have to work with other partners, with other sectors, to carry out what we want to achieve. As to the rest, these are more standard. Nevertheless, it is important for us to put in place good management practices for projects. Sometimes we will require support, and while that might be necessary, it's important. So those are the main pillars of the plan. As I've said, I've already spoken to this, so we're going to save 2 minutes, and then we can move directly to the technological architecture part. I'd like to say a little bit about this. First of all, the digital health record that I'll describe in just a bit. For the time being, we're authorized to implement it in 2 regions in Quebec. That represents 1,000 people out of 1 million people out of 8 million. And the Treasury Board believes that this was too risky to deploy this to the 8 million population of Quebec, which would involve several hundreds of millions of dollars. So we were asked to demonstrate the value in this file. So we launched a first bid for tender, and as you saw in the news, and again, I can't tell you exactly what day this will be released, although it's coming up very shortly. And the second point, it's the finance, procurement, and human resources. I've already mentioned it. I've mentioned the dashboards as well. We have some Quebec-wide projects, because we can't simply focus on centralized systems that will take 8 years to come into force, and as a result, our regions and the other areas will be ill-equipped. So we also have other issues that are linked to this digital health record, health plan, and it's basically on a 2-tier basis. And let me speak to that a bit later on. I do believe that it's an important point. So the institution modernization plan, I'll get to it in a minute, and you see the numbers here. So over 3 years, we've increased the IT budget of the health ministry in Quebec. So that is in the entire health and social services. That's 950 million over 3 years that were earmarked. So that's substantial. It's the very time that I think we see this kind of commitment in technology. So let me come back to the notion of speed and a two-tier approach. So we've developed 9 modernization plans. And as you see, that's quite intense. There's a lot of information. Nevertheless, we've established priorities. There's some 15, 16 priorities that are closely being followed by the Ministry of Human Resources and the dashboard. So we have primary care access. That is a major issue in Canada as it is in Quebec as well. Telehealth is part of access to services. This is not a separate system from everything else that we do. Sometimes that's how it was designed at the outset, but that's no longer the case. This has to be part and parcel of the system. And there's also first-line access. We have a front-line access window where patients can contact physicians thanks to platforms and with the involvement of healthcare workers if required, who explain to them how to access if they say, I need this. That's not the best possible service. We do want to find the best service, and it won't necessarily be focused on a profession. We want to focus on the patient. Obviously, we want to apply this to possibly family physicians and other services. We also have the entire transformation that this system will bring about, and this is all outlined here. Here is really the notion of interoperability. And this is where we come to the patient portal. And as my colleague from British Columbia will explain in just a bit, and as you've seen, we're talking about creating a portal called Your Health, which allows citizens to access a single portal and not have to go to various sites. Ideally, I think there'll be a number of different portals because this still requires a number of systems. But over the next 2 years, we've been asked to speed this up. So if we wait for the portal to come in, for example, for a digital health record to be ready for a province like ours, that might take 8 to 9 years. The idea is to start feeding data into this and to provide citizen access. And of course, all of this has to be built on data and on interoperability, which isn't far away. So I won't review all of these elements. It's just to say that we're covering youth. We also cover mental health, home care, public health. We also have performance systems, and perhaps there are some suppliers here, but as part of a digital health system, we have to cover all of this. We expect all of this to be ready shortly. So this brings us to the notion of a decentralized plan for technological modernization. As I was saying, for the ministry to pilot all of this, but to give enough room for institutions to put together a decentralized plan, that is a major point. So the decentralized plans involves institutions that must commit, thanks to a substantial increase in budget. They must develop systems to replace paper, to be in the cloud, and to prepare for this digital transformation. There's a great deal yet to be done to achieve it. And this plan must include outcome indicators. That it is not a tech plan for the purpose of being a tech plan. That there are going to be follow-ups by the ministry and of our teams, and this has to have an impact on 3 axes. That is an indicator on reduction of pressure on staff, because everywhere else we're facing staff shortages. We want to have an indicator on quality of service improvement, and we're also looking to improve everything that involves productivity. That is in emergency surgery, hospital flow, mental health, youth protection, primary care, etc. And this is the responsibility of the CEOs in Quebec. There are 33 of them in Quebec, and they are called on to take steps to achieve these points. We've taken stock of this. We now have 347 million that was invested in these plans, and we're working on IT tools. There's also the cloud that's also covered. We also have transition plans. We have security that must be put in place. We have more than 200 indicators that were submitted to us. So half of these work on waiting times and access. There is also some on staff shortages. And I'm not going to review all of the examples. I do believe that you have those in the presentation that's been translated. The idea is to support the technological modernization. But again, we always want two things to move forward in parallel. And as we often say, there's a metaphor we like to use in Quebec saying that the digital health record is a little bit like the James Bay of health information. And it's absolutely a key transformation and a key effort, but it's not going to heat our houses for the next 3 winters. We're going to have to heat our houses for 3 winters first, otherwise we'll freeze to death. So we do have to move ahead step by step. So once again, that's the James Bay metaphor, and maybe we can talk about Everest, but we'll see. So let's get to the digital health record. There are a number of points we have to take into account, as I've already mentioned. We need to amend the legislation. Currently, under the Act, this is not allowed, and we've showed you this on the slide. It was drafted, and it was Bill 19 that was under the preceding government. It's accessible, and it's public. It's there. We have a whole act that we can go and study. And it'll be called Bill 2 during the next legislature. It has not yet been passed due to the political calendar, but to give you an idea of its priority, that'll be the second one on the bills that will be studied briefly, shortly rather. So I'm going to show you a bill, and again, it has not been passed yet, and it's not law yet, but the idea is to remove all of the hindrances we had in place to build a health record that will be implicit. You'll be developing a health record. This is data either from the private or the public sector. The idea is to create a national health repository. But to that end, we have to ensure that it's accessible, that very stringent rules govern how this information is shared. It won't be so easy to take out data. Nevertheless, there will be complete transparency as to who accesses this data, whether a citizen is accessing the data, etc. Obviously, we have major security parameters that will be in place. They can go as far as requirements for standardization, for rendering the information secure, and the data will be used for care. We want to make sure that the patient has an oversight of his or her information or can delegate information to family advisors. We also want this to be available to researchers, to teaching, and healthcare workers. That's going to trigger quite a lot of debate once the briefs are tabled, but it is very interesting. But without this would hinder our digital transformation and data flow. So once again, sorry about that. That is the slide that I actually wanted to show you. I apologize. So what is the digital health record? It's all of the health information that one could imagine having in our lives, as well as the one that we want to enter into our system as our citizens who are very different, and as well as a questionnaire where we want to assess outcomes or our patient experiences. All of this will be there. So we had to convince the government. It took us some time to convince them. It took a little bit of time to carry this forward. As you know, at the beginning, we already had one, and now we're in a call for tender, and now we are renewing a call for tender, the bid, so that we can move forward. As I've already mentioned, there are a number of different elements contained in our healthcare sector, but there might be two factors that I should mention that I think are key, and it's obvious on the next slide. So I'm going to spare you all of the benefits of this. We're all familiar with them. Today, it's not a question of knowing whether we should have this digital health record. It's how and when and how much will it cost. It's not about whether or not to do it. Those are all the right reasons already. And of course, we're part of that. And we're not ahead of anybody in Quebec. And on the digital health record, for example, if there are a number of hospitals, or we have some 6, 7 in Quebec who don't have it, nothing at all, and then we look at perhaps 2 or 3, 4, 5 centers that have made some progress, but that's not major. So what's our reality? Well, that's what it is. It's paper a great deal, our plans and systems that were put in place to achieve specific objectives, and we were promised that eventually this would come because of interoperability. We were promised this 20, 25 years ago when I came in. And I think these were non-truths, and that's the objective then. So we said, well, what will our approach be? And I've zoomed in on the right-hand side of this. The infrastructure of the digital health record that we want to put in place is quite simple. There are 3 levels. You have the integrated health record, which is an integrated product that will integrate most of the systems. About 90% of this is required at provincial side, but we also have IT systems in parallel. So we have 2 layers here. We have the visualization aspect, so that you can see clinical information. And we have that wonderful patient portal that we already mentioned, which will be integrated. And on the bottom part, you have another level, which we hope will be intelligent, and those are interoperability advanced platforms. Not only will they enable us to have systems communicate with smaller systems, but also to work on data flow, on validating data, and to involve all of the systems that were not designed to that end, to not have to wait to normalize languages to exchange information, because today we need to exchange information right now. And sometimes it was entered into the systems. Perhaps we have some tools now that allow us to allow this information to flow, to exchange it. And this is very important because bit by bit, this enables us to build the infrastructure we're looking to build by connecting all of the existing systems. And I'm almost done. At the end of the day, we have a target that's well known, that's released publicly. We see this, and all of our suppliers will see this as well. We've developed a system that brings down all of the functions here in blue and with the various layers in that, and the systems that will be connected to that. So those of you who remember the DSQs, that's the Quebec health records. They will still exist, but one day they'll disappear because eventually we'll have the electronic health record and say the former one will say to the young one, I was your father, and this is your destiny. So at the end of the day, they will have succeeded in doing this. And these objectives are familiar to you, and I'm not going to cover them again. But there are 2 points here. Our objective is to really be patient-focused. We have 2 targets that we have to achieve at the same time, is to reach level 6 on the MRA hospital level, but also achieve the same level on the outpatient one, the continuity of care model, maturity model. And that's something that's very important for us, especially I care for it. And we really want to achieve these. If we don't do this, there'll be a level missing and we'll still be institution-centered, or hospital-centered, but really we're looking to go further with respect to interoperability. So that's the idea underlying the plan. And it's the idea of the plan that we're putting in place. I know it's ambitious, and I'd be very happy to answer some of your questions, but the idea was really to share with you what our final destination is, at least the plan and the voyage that we've started with the world all around us. Thank you very much.
Okay, maybe we've got a couple of
We still have a few minutes. Do you have any questions? Unfortunately, the interpreter can only hear a question if a microphone is being used.
Alors,
The question is, why redo the call for tender for the digital health record, because the legislation has not yet been passed? Well, for those of you who are expecting this, I can't quite say why we're publishing it again. Obviously, there's certain things that I can't speak to. As to the showcase project, that is possible in both regions for the digital health record without the legislation having passed yet. As a result, we have to manage a mutual consent and all of this. So there's certain constraints that we're attaching to our call for tender. We can do that, but we cannot table a project that runs counter to the law. And once it's been designed, of course, the idea is to benefit from legislation that will be passed. But if ever there were some kind of major obstacle on the legislative level, we've kept both options available to us. And that's not why we're doing this publication. Does that answer your question?
Oui.
Well, the question was this. This is an 8-year plan to deploy across the boards. But how will citizens benefit over the next 3 years? Well, there's a two-tier answer to this. 3 years is the time where 1 million people will have their digital health record. That's 24 months of deployment once we've selected the final product. That's 1 million people who will have access to a digital health record with the portal and with the information exchange. In parallel, we were asked to work on sped up systems. We have the frontline window, which we'll be deploying for all citizens of Quebec. We will have our virtual care platform, which will be deployed for our first specialty, and then it'll be deployed for 7 others in the coming years. We're also working, and again, that's the first, but it's not a secret, we're working to ensure that access to second-line specialized services reuse part of what we're already putting in place, and we might enhance this so that we can better manage access to second-line services. And finally, that is Your Health Portal. That is in 2 years, 2 years from now, all of Quebec's citizens will already have partial access to the integrated information portal to schedule an appointment, to know where they're at with respect to the appointment they've scheduled, to also access some health information. Of course, we're going to optimize what we have in the Quebec Health records and the platforms that I've just mentioned. So that is the two-tier strategy. So to immediately release elements and by building the infrastructure at the same time. Does that answer your question, Mrs. Jose?
Okay.
The question is whether or not we could address that visualization portal for clinicians, because we haven't heard a great deal about it. Well, the idea is that as part of the transition we're putting in place, there is existing data in many systems, and you'll see that here in white. And we're going to develop a record for 2 hospitals. Now, it's important for the continuity of care. It is important for us to also propose to healthcare workers a means of accessing this existing information. So we've identified a level for the image, and it was approved by the Treasury Board in August of this year. So we will be acquiring an image visualization system, and we'll be modernizing this Quebec health record system, which is a little bit old, but we are going to update it. We're going to modernize it so that it can receive information from the systems that we're deploying in the short term, all the while providing access for the long term. So it's a tool that's interesting for us to manage this transition to a completely available record for everybody. That's the beginning of data exchange to make sure that it is all continuous. Thank you very much.
Merci, Philippe. Très intéressant.